So tomorrow, you're going to see a lot of people wearing teal. It is an annual day to raise awareness about ovarian cancer. So we're going to talk a little bit about that today. We have two guests, Dr. Jennifer Rubatt, I think I got that correct, and Molly
Zwerdlinger.
Thank you, Molly saved me right now. Jennifer, let's talk with you first.
Sure.
You are with the Gynecologic Oncology Medical Director at AdventHealth, I think. That's a long one too. But first of all, let's just talk a little bit about your background on ovarian cancer and kind of where you're seeing things going. It is one of those cancers that so often no one had any sign that they had.
Yeah, it's very interesting. The symptoms of ovarian cancer are things that are very common to women in general. So things like bloating, getting constipated, just feeling not right within your belly. And these are symptoms that kind of part of womanhood. So it's really difficult to tell when this might be a reason to go see your physician and tell them, you know, I'm having some pain or this doesn't quite feel right. But that's a big reason we don't diagnose ovarian cancer often until it's already stage 3 or 4.
And that's the thing we don't want to hear, because that limits some of your options for treatment and other things as well. Molly, I have to bring you in because it's really interesting. You know, you've been down this road and you've also made some really important decisions regarding your own health. Tell us a little bit.
That's right. So I have a family history of cancer. So I chose to do some genetic testing 10 years ago to find out if there was a genetic component to the cancer in my family. Unfortunately, my aunt died in her 30s from ovarian cancer, and my grandmother is a breast cancer survivor. And so I tested to find out if I could be preventative in my health.
And you found out you were positive, right?
I have a BRCA2 mutation. So what that means is I have a higher risk of developing ovarian cancer, breast cancer, pancreatic cancer, in men, prostate cancer, and also melanoma.
Wow. So your decision was?
So I did screening for about 8 years, and then about a year and a half ago, I found a mass through a routine mammogram in my left breast. Luckily, the mass turned out to be benign, but I chose to take preventative and prophylactic measures, and I had a preventative double mastectomy a year ago this month, and I also chose 5 weeks ago to have a hysterectomy to reduce my cancer risk from 86% to 2%.
And when you hear that, Jennifer, how does that make you feel? That must be like, first of all, ovarian and breast cancer, they're like this, right?
They can.
You must say you're doing something. Is that it?
Yeah, that's the benefit of doing the genetic testing is that we can try and risk stratify or even screen and then hopefully prevent anyone from getting ovarian cancer, since it does have kind of a dismal prognosis.
And last but not least, we want to tell people to wear teal, but more importantly, you said this briefly a second ago, there are no dumb questions. Ask questions. Talk to your doctor.
Talk to your doctor, tell them how you're feeling. If you think something doesn't feel right, say something.
Okay. Well, let's save some more lives. Thank you both for coming in. We really appreciate it. And we hope a lot of people are paying attention and raise awareness about ovarian cancer. We'll be right back.